You might get headaches or chills. My mom actually had the chills, and I think she had a low-grade fever too. Hey guys, I wanted to come and give you some information about the shingles vaccine, namely the top side effects from getting the vaccine. Many of you guys have had questions about this. I recently did a video on 5 common misconceptions about shingles, so make sure you check that out. And a lot of you asked about the vaccine, so I thought I would do a video just on that. Remember to talk to your doctor about what really applies to you, because remember, everyone is different. But this is some general information about the vaccine first, then I'll talk about common side effects. So first of all, the vaccine we have is called Shingles. This vaccine is generally given to people 50 years old and older. Okay, that's who it's for. And according to the CDC, people in particular who should get it, so it's for 50 and older, but in particular, if you have had shingles before, you should get the vaccine. If you received the old shingles vaccine that's called Zostavax, we don't use that anymore, you should get Shingrix, the new one. If you're not sure if you ever had chickenpox, the CDC still recommends Shingrix. And the reason why they say that is because 99% of Americans over the age of 40 have actually had chickenpox, even if you don't remember having it, which I think is really interesting. Also, if you're on low-dose immunosuppressants, again, this is according to the CDC, you're able to get the Shingrix or the shingles vaccine. There is no maximum age for getting the vaccine, okay? Remember, it's 50 and over, 2 doses. Now, there are some people who should not get this vaccine. You should know about that. You should not get it, of course, if you have an allergic reaction to any of the components. That makes a lot of sense, right? If you have tested negative for immunity to varicella zoster, you should actually get the chickenpox vaccine first. The CDC talks about this. I'm not going to go into details. If you currently have shingles right now, you shouldn't get the vaccine right now. You got to be completely well done over and better from that. And then also breastfeeding and pregnant women, it is not recommended for. This is, again, according to the CDC. But you got to talk with your doctor to find out what situation applies to you. Now, let's talk about side effects of the vaccine. Some of you have mentioned that you got side effects. Some of you really didn't. My parents got some. My mom had more side effects than my dad. But this is the thing. Side effects typically are 2 to 3 days in length or so, which is not uncommon for vaccines. Most people will get a sore area on their arm and mild to moderate pain, which we're kind of used to from different vaccines, and maybe some redness and swelling, okay? That is, and those are the most common side effects. However, some people may get more what we call systemic side effects. You might feel tired. You might feel like you have muscle pains and just sort of achy all over. You might get headaches or chills. My mom actually had the chills, and I think she had a low-grade fever too. Low-grade fever or fever is what I was going to mention next, because some people do get that. Some people get stomach pain and nausea, those stomach symptoms, which is not the most common, but it can happen. Again, most people just have sort of the mild to moderate pain at the arm. Some people can get more symptoms. 1 in 6 people, according to the CDC, may have to sort of curtail their activities because they're not feeling so well. My mom actually had to kind of take it easy the next day after getting the vaccine because she felt kind of a little punky, as we say. And interestingly enough, side effects are most common in young people. Who would have thunk it? So those are some, just some general information you should know about the vaccine. I know a lot of you guys are talking about this, and I'm so glad to see. I'm a fan of vaccines. Shingles is a bear, or it can be rather, so we don't want you getting shingles. Make sure you talk to your doctor to find out what's right for you and go over the details with them. I'm Dr. Jen Caudle. It's good to see you as always. If you have not liked and followed my page, I invite you to do so. For those of you who send stars, I respond to you personally. Thank you in advance. And guys, consider joining my subscription group, Dr. Jen Superstars, for exclusive content. Guys, I'll talk to you soon.